My name is Bernhard Kainz, and together with Professor Menxing Tang, I'm leading the affordable imaging stream in the CDT for smart medical imaging. I remember quite well when I was, for the first time, sitting at the controls of an MRI scanner. I felt like a pilot in control of a massive jet. Millions of pounds of technology under my control. Considering the installation costs, the need for a special room, the army of people needed for running the system, every hour I spent there costed thousands of pounds. The cost of an average MRI scan is over $2,000 in the worst of today's healthcare systems. Simpler imaging modalities like X-ray and ultrasound are still in the range of a couple of hundreds of dollars per examination. But perhaps most problematic is that medical imaging is confined to hospitals, requiring highly specialized expert personnel to acquire and to interpret the images. A permanent lack of experts leads to patient waiting times and missed essential examinations. Because of that, there is a real risk that image acquisition is not done at the required frequency and to the required standard, and potentially critical patterns of disease go undetected in the majority of patients. Powerful computational tools based on machine intelligence can support frontline of care, generalists and experts alike. Such tools have the potential to go even beyond human level performance, thus to reduce the strain on the healthcare system, which can be induced by forced referrals and missed opportunities to detect disease early. This enables, of course, better care for individual patients and overall improved clinical outcomes. Very often artificial intelligence is used as an umbrella term for such approaches. Augmentation of human abilities and democratization of rare healthcare expertise are the ultimate goal of such human support systems. So our main aim is that high quality diagnosis becomes available directly at the places where it is needed the most. At the bedside of immobile patients, in care homes, at the sites of an accident, in disaster zones, in rural communities, of course in developing countries. Currently, for these point-of-care scenarios, the most promising go-to imaging modalities are, for example, pocket-sized ultrasound imaging, wearable sensor technology, bedside MRI and CT from mobile X-ray machines. Combining this with smart medical image and data analysis algorithms, we in our stream believe that affordable imaging research has the true potential to fundamentally change healthcare paradigms in the future. The students and supervisors in the affordable imaging stream work together on solutions for health screening, for example during pregnancies, on various scan guidance systems. We aim to empower non-expert users to carry out crucial biometric evaluation and the detection and characterization of lesions as independent as possible. We address the challenge of obesity in relation to medical imaging, and we develop simpler, more accessible and cost-effective radio tracers for molecular imaging, for example PET imaging, SPECT imaging and molecular radiotherapy. So that was fun. What I tried to create here is something we know as an uncanny valley. It's good, but it's quite not there yet. In medical image analysis, we are pretty much in the same situation, and we need to keep pushing to get our methods to the people who would benefit most from it. Thank you very much for continuing to support our CDT and the students within it. I think we still have a long way to go together.